but I
I
don't
was
trust
tagged.
pharmacists. I don't understand why anyone would go to school for 8 years, as long as it takes to be a doctor, and then just work at a Shoppers Drug Mart.
You guys know me, I'm always down for a good pharmacy joke, but honestly, that wasn't funny at all. There is nothing wrong working at a community pharmacy. I think the biggest misconception that the public has on pharmacists is that all we do is just slap labels on things, put prescriptions in bags, but there is so much more that goes behind the scenes. Also, by the way, you can get a pharmacy degree in 6 years, not 8. And yes, it's still a doctorate. When I'm explaining to people the main difference really between like a doctor and a pharmacist, I think the best way to compare it is like a doctor's really great when it comes to like diagnosing things, and with pharmacists, they're probably the more expert when it comes to treatment. So when a doctor prescribes something, if they know that this may not be the best option for the patient, they can then relay that to the doctor. And if you go to a doctor's office where there are pharmacists, you probably are getting the best care possible. When I used to work in ambulatory care as a diabetes pharmacist, the doctors would really heavily rely on us to give them an opinion on a patient's treatment. Because to be honest, it is impossible to be an expert on all disease states. And with a lot of doctors not having time to see their patients as much as they want to, they need the help from every other healthcare provider. And one of the most fun things I had when I worked in ambulatory care was actually going back and forth and talking to a doctor and, hearing their side and then hearing mine and, working together to actually do the best for the patient. And then just so everyone knows, there are a million things a pharmacist can do with their PharmD degree. They don't just have to work at a CVS or, work in a hospital or teach. There are so many different avenues, and I think that there's just not a greater awareness about it. So yeah, I'm all for, making jokes at the pharmacy, we're understaffed, we're not answering your phones or stuff like that, but don't make fun of a whole profession just because you're ignorant to know what pharmacists actually do.